Okay.
All right. So, good morning, everyone. This is Dr. McFaal. I'm going to talk today about the locked-in syndrome, which is also called pseudocoma. So, basically, what is the locked-in syndrome? So, LIS. To illustrate, to give an example, I'm going to talk about the case of Jean-Dominique Baume, who was actually the French editor of Elle magazine, who suffered from LIS and died from it. So here you can see him with his wife at some point. So Jean-Dominique Baume suffered a major stroke at the age of 43. He woke up 23 days later, entirely speechless. He could not blink his left eyelid, and he had LIS. Basically, his mental faculties were completely intact, but most of his body was paralyzed. He had lost 60 pounds in the first 20 weeks after his stroke. And what is striking is that despite his condition, he wrote a book which is entitled The Diving Bell and the Butterfly, where he used a system called partner assisted scanning in order to write it. He edited the book entirely from his head, one letter at a time, and unfortunately died of pneumonia at 44 years old. It was basically 2 days after the book was published and a year after his stroke. So, definition and presentation of LIS. Locked-in syndrome is defined by NORD, and NORD is a national organization for rare disorders, as a rare neurological disorder in which there is a complete paralysis of voluntary muscles, except for the ones that control the movement of the eyes. So basically, a person suffering from LIS wouldn't be able to show facial expression or voluntarily chew, speak, breathe. It wouldn't be, or she wouldn't be able to move eyes side to side. However, that person would be able to communicate by coded eye movements. And that condition was first described in 1966, which is not too long ago, by Plum and Posner as a cerebral medullospinal disconnection. So what struck me is that before 1996, I wondered what happened to patients suffering from LIS. A lot of them would have died or would have been not diagnosed at all with um, the proper condition. So, what are the causes of LIS? LIS can be caused by brainstem stroke. So, basically, when there is a lesion of the pons, the pons is the relay of information to other parts of the brain. It can also be caused by a traumatic brain injury, so concussions, any type of TBI, tumors, diseases of the circulatory system, anything that would cause bleeding, or destruction of the myelin sheath, which is around nerve cells. And basically, it can also be caused by infections or medication overdose. So the trick is the diagnosis because it is made clinically. However, it can take months to diagnose, first of all. There are a variety of tests that may be conducted to rule out any type of existing conditions, such as, MRI, CT. Those would show the damage to the pons and any blood clot in the arteries of the brain stem. EEG may be used as well to basically evaluate normal sleep patterns. Regarding treatment, unfortunately, there is no cure or standard treatment for LIS. However, there are functional neuromuscular therapies that are put in place to stimulate the muscles or to stimulate also the paralyzed muscles and by using electrodes. There is supportive care to prevent complications that may result from UTI or pressure ulcers or immobilization, and physical therapy as well to prevent the limbs contractures. Good nutrition is important. There are several devices that are used to communicate. Antispasmodic drugs are also administered to those patients. And there is progressive verticalization in bed in order to allow the patient to move from being flat in the bed gradually up, and speech therapy, obviously. So in order to upgrade the quality of life of those patients, as I said before, there are several assistive technologies. One of them is the eye gaze edge, which is basically an eye-controlled communication system. It does allow patients to control, they can use a tablet or they can use a computer by looking at words on the video screen. This is very popular, and this is a little bit what was used by Bode when he had to write his book at that time before dying. And there is other sophisticated computerized interfaces. For instance, one of them is the one that the patient can use to control their wheelchairs. So the prognostic and recovery. So there is no cure. So the patient won't be, will never be cured from LIS. However, if the patient recovers the ability to move his eyes horizontally, then there is good neurological prognosis. Now, the great majority of patients are removed from tracheostomy during the first months. Once those patients are stable, their life expectancy increases by decades. And something which is striking is that those patients, there are infrequent demands of euthanasia. They are very, very resilient people because they are in their body, they are just trapped, but they are there. So they are fighters. For 50% of patients, gastrostomy removed during the first year. If there is good motor recovery, then there will be a better level of independence in their activities. It has been seen that few people return to work. However, they find, because of their spirit of resilience, they find creative ways to resume social roles, and they remain completely aware. They're just trapped in their body. I wanted to give a little bit of epidemiology statistic here. So LIS affects around 1% of people who have a stroke. About 90% die within 4 months of its onset. About 90% die within 4 months of its onset, especially in developing developing countries, because over there, those countries, there is a lack of resources, infrastructures, technology to assist them. However, the life expectancy of stable LIS patients, we can see that 83% would live 10 years and 40% would live 20 years. So basically, that would conclude this presentation. It's a very sad condition. It's a very sad condition, but it's better than before 1996 because now it has been basically diagnosed, and there has been resources and technologies to assist those suffering from LIS. Thank you very much.